we want to talk about something that a lot of people may not know due to the fact that what has happened for the past couple of years in regards of COVID-19. People have been giving too much concentration, too much attention to COVID-19, and unfortunately some of the other things people tend to miss out as well.
That's
what are we going to
right,
be talking about
Mio.
today?
And actually talking about it, you know how we always bring in our people, our guests, and especially the sole contributors to our community, our society. We bring in more people to help you guys, as to give you guys more awareness as to what's going on. And whether you know or you might not know, we're going to be talking about hepatitis and medicine today. So, I've actually did some research before coming onto the show, of course, you know, as usual, how we always do.
Yep.
And I found out that hepatitis B is actually the most common, and not just in Malaysia, but also in Asia. I'm not sure whether if that fact is honestly true, but we will find out more with our guests in a bit. And of course, if I'm not mistaken, when we were in school, we also had these hepatitis vaccines, I think.
Yeah, those shots during the school times.
Yeah, I think that was also taken. So make sure you guys, you know, I know how, as Mio mentioned, we were so focused on COVID-19 and getting vaccines for COVID as well. Make sure you guys ensure you get a pretty good health check, and as well as for your hepatitis shots and all. But you know, going on to the show, we actually have here JERICA YOON, who is the pharmacist in Selayang Hospital. And why we are actually touching on today's subject. Do you know why, Mio?
I do not know.
It's because 28 July 2022, which was 2-3 days ago, we had World Hepatitis Day.
I knew that. I was just like, didn't want to screw the pooch, basically. But yeah, that's what we're going to be talking about today together with our guest, JERICA. First of all, thank you so much for coming down to the show. Now, as what she has explained, quite lengthy, I might add, but maybe a lot of people do still really want to know what actually is hepatitis, because we've heard there's A, B, C, D. I even found out there's E. Apparently, hepatitis E. So, so what actually is hepatitis? JERICA, please.
Okay, good morning, Mio and Erin. Thank you for having me here. So regarding your question about what is hepatitis, so hepatitis actually in medical term, it means inflammation of the liver. So the liver is actually a big organ that is located in the upper right side of our belly. It has a lot of functions. It helps to filter blood, it helps to process the nutrients, it helps to metabolize and detoxify the drugs or medicine that you take. So for current situations in Malaysia, and in fact it's in worldwide, this viral hepatitis is actually a public health challenge. Yeah, it actually is responsible for more than 1 million of people death, every year. And in fact, in the recent study by the WHO study, this viral hepatitis is also being regarded, it contributes to the highest number of the death rate compared to other major infectious disease such as like HIV, tuberculosis or malaria. So you mentioned about the World Hepatitis Day. Yes, this year our theme is Hepatitis Can't Wait. So we actually really can't wait, to diagnose all these people and then to get them treatment, because I think the awareness is kind of low in our public. So this viral hepatitis is actually something that is preventable and treatable, but it's very saddened that people are not aware of it. They don't come and seek for treatment. So therefore, it is causing a lot of like late complications. They already come to when they come to us, it's already reached the liver cirrhosis, which is already the liver is hardening, or that liver cancer. There's very limited things that we can be done.
Oh, I see. Wow. Actually, to be honest, I would have to say I didn't think it was that serious until you actually mentioned it. And, talking about World Hepatitis Day, which was that again back in 28 July 2022, just a few days past, I think that is something, having this kind of days that we have, to bring awareness to you guys. I think it's something that's really, really important, really crucial to have. And I like how you mentioned that people aren't aware about, especially what goes on in your body. I mean, even I would say, even I'm not aware what's going on in my body right now. But having this kind of World Hepatitis Day and so on, it does bring out the awareness. So actually, JERICA, just going more further into our topic for today, what are the common symptoms or signs that you might see for hepatitis?
Yes, we'll come to the signs and symptoms of the hepatitis. Many times, this hepatitis, we call it like silent killer. Mainly because of most of the time it's asymptomatic. It doesn't show any specific of the symptoms to people. So it's very not significant. For example, like is like nausea, vomiting, muscle pain, joint pains, like loss of appetite, mild abdominal pain, feeling tired. So because of such a non-significant symptoms, people a lot of times they don't really go for the seek for a treatment for this. And when we come to more serious of the symptoms, when your liver function is being affected, so like example, the symptoms are like the yellowish of the skin or the yellow eyes. They call it jaundice.
Jaundice, yeah.
Yes, or the pale color stool or dark color urine. So those are more on the severe stage. Then the symptoms will tend to more obvious at the time.
Yeah,
I think jaundice is the most obvious.
Yeah, as you can see, actually, our beloved viewers, you can actually see on the screen right now the infographic that states the symptoms of viral hepatitis for A, B, and C. As mentioned just now, JERICA, I mean, like A, B, C is just part of it. There's actually D, E, and F because, like, just to prove as well, I did my research as well. There are some other hepatitis out there, but some are more severe than others. Some are, that you need to, really take serious of, and some that is something which is quite, not the norm, and it's not really that common that happens within a society. Share with us all of those letters and why are they just A, B, C? It's easy to identify, is it?
Okay, right. So when you come to actually this hepatitis, it has many causes. Yes, the most common causes are these viral hepatitis, the viral infections.
Okay.
So, but they are actually also have other non-viral causes, like for example, the drug-induced, the painkiller that you take, some antibiotic you take. Sometimes it may also cause the liver injury, or the heavy alcohol drinker. They also can cause the liver inflammation as well, and some like fatty liver or autoimmune disease that also can contribute to the hepatitis. But today, we focus about the viral hepatitis. So Mio, you have mentioned about the types of the viral hepatitis. So there are mainly 5 types. A, B, C, D, E, as you mentioned.
Yeah.
So the more common in Malaysia, we have the A, B, and C. Okay, D and E is really less common in Malaysia. So we focus on the A, B, C, right? So for the these 3 types A, B, C, they are actually different type of virus. They have a different mode of transmission. So let me explain a little bit on this A. A is actually very, it mainly transmit through the contaminated food or drinks by the feces of the infected person. So we call it fecal oral. So if a person who handling your food is like not really hygienic in the way they prepare the food and the food got contaminated and you consume it, then there's a chance that you got the hepatitis A.
Sure.
While for hepatitis B and C, it's mainly through blood. Right, so in fact, in Malaysia, for hepatitis B, the most common way of transmission is from the mother to child. So, example, if the mother have a hepatitis B, so when they deliver the baby, it's through the birth process, I have a high tendency to pass it to the baby. So that's the major route of transmission for hepatitis B. But of course, other ways such as the blood transfusion, needle stick injury, sexual contacts, those also are possible way of transmit. Right. So for hepatitis C, in Malaysia, majority of the patient actually got it through the like as high as 60% of our patient actually is needle sharing.
Needle sharing, okay.
Yeah, but other methods are also included the blood transfusion, surgery, organ transplantation. Well, especially before the year of 1992, right? So because before that we don't have the test available for hepatitis in the blood products. Okay. So if they have any history of having this surgery or receiving blood before that year, then they have the risk factors and they may need to go for screening. Right?
I think some of the risk factors, like how you mentioned, like through blood transfusion and all that, like for example, tattoos. That could also be one of the causes.
That's true. That's true. You did your study
of needles and all.
Exactly.
So make sure you guys, look at where you get them done or like the places you eat as well. Try to look at the hygiene-wise, take care of yourselves.
And as well as, sorry to interject, but as what you mentioned as well, I mean, the transfer of fluid, like through sexual intercourse, because like I've also, again, just to outdo you, I also researched and actually had something about how by sexual, it could actually be transferred during intercourse, all those kind of activities as well, because it is fluid-based anyway. That's how you actually transfer it from one patient to another. And I'm surprised, that you've actually said that D and E is a bit more uncommon. Why is that, do you think, before we go on?
So for the hepatitis D, usually it will have to come together with hepatitis B. The person will have to have both.
Okay.
For the hepatitis B, they only will contract D.
Alright.
So D is also through blood. But so far, as long as in my service life, I have rarely seen it, D.
Okay.
Yeah.
Right.
E is also through the oral fecal, same like A.
Alright.
Yeah, and it's usually also through because of the poor sanitation.
Alright.
Yeah, but it's not common in Malaysia.
I see. Okay. Actually, you know, Mio, why is it A, B, C, D, and E?
Yeah, the
It's actually
alphabets.
because they are silent killers. You don't know which one it is. Because I'm just quoting JERICA, which mentioned that hepatitis is silent killer.
I hear that. Yeah.
So actually, talking about all that, you've also mentioned about all the causes through alcohol, injections and all that, hygiene purposes and all that.
Yes.
What is there any treatment for hepatitis? As you said, you know, they are silent killers. You don't know if you actually have them.
Yeah.
So how do people know? And if there is any treatment, if you would please let our audience at home know as well.
Okay, great. So for this treatment, for hepatitis A, most of the time is they are short-term and they are acute illness. So a lot of time we don't really have a specific treatment for them. It's mainly a symptomatic treatment. So we will advise patients go for a lot of rest, keep themselves well hydrated, and then have a balanced diet. Okay, so usually it will self-resolve after a few weeks. Okay, so for hepatitis B, yes, we do have the antiviral available for hepatitis B. Right now, there's no cure for hepatitis B, so the antiviral mainly use it to control the virus, okay, to suppress it, to prevent it to have a continuous, damage to our liver. So we have, like example, entecavir, tenofovir. These are the antiviral that we use for hepatitis B. They are very well tolerated, very minimal side effects. It just need to be taken once daily. So it's very easy, simple regimen for a patient. But to bear in mind for hepatitis B, not everyone say you have hepatitis B, you need to take antiviral. Not that case. Usually we still allow the body, have time to fight with the virus itself. We only start the antiviral when your body is showing sign that it's failing to fight with the virus. Only we will give the antiviral. Because the reason being that these antiviral, once you're being started, and a lot of time you have to continue for kind of long term. Yeah.
Alright.
Yeah. So we will still allow chance for the body to try it yourself, and then before we introduce the antiviral. But of course, when you're on the treatment, then you must make sure you continue it. You don't stop it yourself because you are dealing with virus. So if you stop it yourself, then you have a risk of this virus will flare up. Then it can be even more severe than before you start treatment.
Yeah, everything.
So
I mean, like at the end of the day, you need to be mindful. Whatever it is that you have, it could not just be hepatitis A, B, or C. It could be any other things as long as you take proper precaution, proper measures in regards of making sure that you control yourself and you get the advices from the experts. Speaking about experts, we know what roles the doctors do. They treat, they prescribe, they give out suggestions and give solutions. But what about pharmacists? What do pharmacists contribute in making sure that the hepatitis treatment is being done in the best way possible?
Okay, well, for myself, because I'm a pharmacist, so I'm dealing a lot with like the treatment counseling for our patients. So for example, like hepatitis C, it actually now we have very effective medicines. Since like 2018, we have this direct acting antiviral that we want to use it to treat our hepatitis C patients. So our pharmacist role is we may need to counsel the patients like, right now we have these medications for you, and then it's very simple. For hepatitis C, the duration of treatment is definite. It's like 3 months to 6 months. It's unlike the hepatitis B, you have to take it for long term. Hep C is very easy to treat. 3 to 6 months, we have very effective drug, simple regimen, only need to taking it, all oral regimen, and also well tolerated. So we advise the patient, we tell the patient, okay, how you're going to take your medications, what's the dose, what is the timing, okay, in case you miss your medication, how soon you still can take it, and also the storage of the medication, away from sunlight, all this, because that is to ensure the quality of your medications. But not forget, for this hepatitis C treatment, they tend to have a lot of drug-drug interactions. So we also need to get the full list of medication from patient and to check if there's any interaction with the drugs. So because like for traditional and supplements, a lot of time we don't have the data for that.
Sure.
So we will also advise patients to stop the traditional method or whatever supplements they are taking while they are receiving these antiviral for hepatitis. And also, I think when patients come to receiving the new treatment, they tend to very worry about the side effects. So the side effects for all these antiviral agents, they are actually very minimal. They are well tolerated. The most is like the headache, nausea, and fatigue, all this feeling. But usually it tends to only happen in the beginning of your treatment phase, and it will slowly subside after a few weeks. So we will advise patients, take a lot of drinks and then to get a lot of rest. Yeah, and lastly also the adherence. Yeah, so that is the main role of pharmacists that we will tell the patient, because you need to tell the patient to adhere to medication. You really have to make them understand like how this drug is going to work in your body, right? So you are dealing with virus, okay? So we are so familiar with the COVID virus. You know that they will tend to easily to mutate into variants, all these. So similar for hepatitis C, if you don't adhere to your medication, then you have a tendency, if sometimes you take your dose and the next day you don't take, then you have a tendency it will become resistant and mutated, all these things. So then it will have a high chance of going to the treatment failure.
Right,
so that's why it is very, very important for us to actually know what it is that you're taking from the advice from a professional like a pharmacist for us to be better. Whatever it is, Hep A, Hep B, Hep C, as long as we are happy. All right, thank you so much to our guests here in the studio, JERICA Apo YOON, pharmacist from the SELAYANG Hospital, to share with us about hepatitis and medicine. Thank you so much.
Yeah, thank you for having me.